Chuck Moon here from LA and going for part 2 of tibia fracture alignment. A lot of this is going to echo things that Ryan said, disclosures. So we don't want to end up like this, right? So assumptions, all of us remember being taught the line the tibial tubercle up with the second ray and you're going to be okay. And you know, it really doesn't always work. And I think it's one of those ortho myths that kind of needs to die. So kind of my big starting point is the fibula is your friend when you're looking at the tibia and you're trying to get it lined up. If there's any doubts about length alignment and rotation, fix the fibula. If you're not fixing the fibula, look at the fibula and see what it's doing. If the fibula is out in left field and you think you've got your tibia lined up, stop, take a deep breath and go, why is the fibula out in left field? There are things that happen. Maybe you had a proximal fib dislocation or something like that that's causing some issues. But beware, always look at the fibula reduction. If you've got the tibia right, and if you look at all of Ryan's x-rays where he got the tibia right, the fibula was lined up. So just also remember, though, there is a little bit of play. So there's about 15 degrees or so play. So theoretically, you can have up to 30 if you're off maximally on both your proximal and distal segments, though that's highly improbable. But there is a little bit play. So your fibula can look pretty good. You could still be off a little bit. That being said, clinically, if you're within 10 degrees rotationally, most of the time, you really can't tell. So here is a patient who has been defeated by gravity. Kind of a relatively regular, typical tib fib. Hello, what's going on? Here we go. And you can see what we did is help ourselves out. We spanned the fibula. And again, we didn't do anything too crazy there, just sort of lined it up indirectly, got a couple of screws in there. Probably could have put a little more bend in the fibular plate, but it wasn't really an ankle injury, so we weren't really worried about pushing that over too much. And that kind of struts everything out for us and allows us to feel very confident about this tibia alignment and place our nail. Oblique fractures. I think these are actually the ones that people get in the most trouble with in terms of rotation, the spiral obliques. They're relatively common, right? These are those low energy twisting tibia fractures. For some reason, they break their tibia instead of breaking their ankle. Personally, I think I would reiterate, if you do it nicely to the tissues, there's no reason to be afraid to open. You can start with percutaneous clamps and things, but a lot of times with the kind of obliquity of spiral, it can be kind of hard to figure out exactly where to place the clamp. And even if you place it correctly, it's hard to judge your reduction because of the way these things kind of twist. So first off, traction alone probably doesn't help you out. You got to play with the rotation. And if you do the traction, you're operating by yourself, 2-pin X-fix, femoral distractor, something like that to help yourself out. Again, look at the fibula. I'm going to harp on that because I really believe in that. And then open it up and clamp it. This case, you can see the fibula looks good. Not so spirally, but one of these oblique fractures that sometimes you can get wrong. And what did we do during the case? I opened it up. I used the evil crab claw. Yes, I do use that device a lot. I'm sorry. I know we're supposed to use small little pointed production forceps and whatnot, but I like a lobster claw for some reason. And it comes along and works nicely. Transverse and other fractures. Transverse fractures can actually be kind of really difficult in this. Again, fix the fibula, that really helps get you in ballpark. If in doubt, open it up. Compare the rotation to the other side. Take a look at the other side clinically before you prep and drape it. I mean, 99% of us do not prep both legs in to fix the tibia, right? Take a look at the rotation of the other side before you cover it up with drapes. Now, the funny thing is, if you actually do, they've done some studies looking at people who have not broken their tibias and compared their rotation from side to side. And actually, people are not actually overall super symmetric in the general population. There's actually quite a bit of mild asymmetry. But the thing is, after they break it, the only thing they've got to compare it to is the other side. So that's what you should use as my recommendation to as your baseline. And you can end up with weird things like this, where we kind of ended up comparing. I don't know what that is. So moving on, were there other high-tech options since we're pushing the envelope and looking at other things? We've kind of pirated some of arthroplasty software, and mostly we've been using this stuff for osteotomies and cases like that, but it can be useful in acute trauma if you really are kind of at a loss and not sure about where you need to be in terms of your alignment. And this is the kind of thing you can get. And what you see here is an image with a ruler on one side and in a electronically software generated plumb line going from the center of the hip to the center of the ankle. And the way we do this is we utilize one of our flat panel C-arms. It doesn't work as well with the regular C-arm. The regular C-arms, you do get quite a bit of parallax out at the edges. With the flat panels, you do not. So these are those square panel C-arms. I don't know if everyone's seen these or not, but these are very nice because you do not get parallax at the edges of these C-arms. It's hooked together with software generated from, in this case, it's RadLink. And full disclosure, this is one of the surgeons at our hospital's babies, one of our arthroplasty guys. And that's why we get to see all this interesting stuff that he's comes out with. But initially, it was actually something that they came up with for limb length and alignment for arthroplasty cases. And, you know, we were listening to them at the various grand rounds and M&Ms and whatnot, and looking at this and going, huh, can we steal this? So we stole it. And this is what it kind of does and what it kind of looks like. And then you get this. So it's a way to create a perfect limb alignment. Now, of course, if the limb alignment isn't perfect on the other side, this doesn't help you out very much, but at least you can get a perfectly anatomic hip to ankle axis. So.